Machino, Associate Professor, Canadian Memorial Chiropractic College. Welcome to you, sir.
Nice to see you.
Dr. Fred Hoy, it's been a long time since you've been on the show, medical doctor, and you used to use a word to describe what you did.
Integrative physician.
Sounds clever to me. Wayne McPhail, journalist and president, Wait and See, which is, I assume, a company that deals with new technology.
That's right.
And Paul Benedetti, lecturer, University of Western Ontario. Let's begin over here. What is the correct term to use? I said alternative medicine. Is that pejorative? Is that critical somehow?
I prefer complementary medicine.
Complementary,
in
okay.
that I think that what you're looking for always is what's in the best interest of the patient, and how does good medical practice, how is that complemented by things that are sort of in this alternative world of nutrition, supplementation, exercise, acupuncture, all these other things that are not in the medical training as of yet, but can complement good medical practices to give the patient the best benefit.
Supplements, exercise, most people would say, I mean, yeah, exercise a bit and supplements, there's a place for them. Surely we're going a bit further here, though. I mean, we're talking about how to deal with someone whose heart might not be functioning properly. Chiropractic, where people might be told this can change your whole way of life. So it's more than just taking a vitamin and running up the stairs.
Well, my area of expertise is in, even though I am a chiropractor officially, I teach nutrition. I have a master's degree in nutrition. I'm a doctor of naturopathy as well. So I understand the limitations of chiropractic. So I'm not someone that's going to say that the chiropractic original philosophy that all conditions are caused by spinal misalignments, I'm not going to go down that road. I don't think it's valid. I think things that Fred's doing here with respect to chelation therapy have tremendous merit for those kinds of patients, in addition to some kind of supplementation where it's appropriate, like coenzyme Q10 and L-carnitine, things that have been shown to be useful in conjunction with good medicine. And sometimes, the person needs to have bypass surgery or what other major mitral valve replacement. No one's arguing that. It's that there is a significant percentage of patients that fall under the umbrella where complementary medicine can tremendously enhance what's going on the medical side.
There is no divide, surely. I mean, and there are gradations here. There are those people on your side who almost reject conventional medicine. There are those in conventional medicine who think that, well, you're a bunch of quacks, really. Where do you stand on this?
I stand from the point of view is if every patient is my relative, my daughter, yes, you would like to do good medicine on this particular person, and you see what's available first in conventional medicine that's cost effective and also less side effect. But then when either they have the feature of too much side effect possible with the possible proposed treatment, or the doctor simply said, well, there's nothing in conventional medicine you can help the patient with. Do you stop from there? If this is your daughter, you stop there? You don't. So on that premise, I try to go beyond and look for what's sensible. I reject many things that was outright lies, and you use your intelligence to differentiate what's lies and what's not lies. But at the same time, by tapping into things that's not conventional, I find useful things.
Okay, but chelation therapy.
Yeah.
I've heard people say it's a complete fraud. There is nothing to it at all. Yet others, and you may well be one of them, who say, no, that this can be life-saving. It's expensive. It can give people false hope. I'm not an expert here. What is the truth of this?
Okay. Anecdotally, and come across patients, there's so many useful cases, and people, generally the one that's without debate is that people have failed 2 bypasses and failed angioplasty, and doctors said nothing else can be done.
It's to clean the arteries?
And yes, and you add on that, and patients suddenly get better and become a lot better. Now, to answer the question, NIH had just granted $30 million.
This is the
United States government have put $30 million to fund a study to prove or disprove or to validate chelation. So Mayo Clinic is involved, Duke University involved, and the trial is a multi-center trial across North America, and the leading trial doctor is a very respected cardiologist that had been doing the conventional trial, and is just going to go on to answer those type of questions.
So that's funded by the National Institute of Health, and so they are really taking a close look at chelation at this point, which is justified, I believe.
Just to make it clear for people, all areas, well, as much time as we have, we'll discuss. It's really the place of complementary alternative medicine, if it has a place at all, if it's dangerous, if it's helpful, if it's just neutral. Back in a few moments on the Michael Coren Show. Keep healthy. I'll try my best, but don't go away. people.
Yeah, well, and a lot of alternative folks are, reasonable people, but sometimes they suggest unreasonable things, and things that aren't necessarily in the best interest of people. That in the course of the years that Paul and I have been looking at alternative medicine, and particularly chiropractic, we've run across again and again treatments and individuals who aren't in the best interest of patients, who are really espousing and dishing out nonsense. That are not doing harm, that as Dr. Hui said, are telling lies, really, about what the treatments can do, the efficacy of the treatments. And, it's really an unfortunate mishmash, that Dr. McKenna said that there are aspects of chiropractic that he doesn't support. Interestingly, because most a lot of chiropractors we talk to would disagree. But they're chiropractors too, so it makes it very difficult for consumers to make sense of even a subset of alternative medicine like chiropractic when chiropractors themselves can't really agree with chiropractic.
Beyond chiropractic, though, I mean, that's a sizable but minority part of alternative medicine. All sorts of areas now. I mean, every high street there are stores selling supplements, some of which are helpful, some of which I don't know what they're meant to do. I mean, there are people who are almost rejecting mainstream medicine at this stage.
Well, I think that there is a concern about mainstream medicine sometimes, and legitimately so when it's a sort of pill pushing. Mm-hmm. But the reality is, most of the time, mainstream medicine isn't like that these days. That's sort of an artifact of a past. That isn't really the case in a lot of cases. You look at what's happening at McMaster University, for example, is a great example of that, of the very integrative kind of approach to things. But integrative on the basis of evidence. And when we hear things like anecdotally chelation works and stuff, well, that's not really how science works. That one person saying, I feel better because I got this, or I got hydrogen peroxide injected in me and I feel dandy, isn't science. And folks with these two guys with a background in science know that.
Okay, but SSRIs, for example, they've been used for depression and anxiety with enormous success over the years. But more and more now we're finding out, first of all, they've been overused enormously. People who have a bad day, or maybe they're going through grief, quite natural, are given a pill. Coming off them can be very difficult. Apparently, damage can be done. There's science behind that, but they've been used irresponsibly. Is mainstream medicine any better than the alternatives?
Well, I think the fundamental difference here is the difference of evidence. That one of the values of the scientific method and one of the values of medicine when it's done well is that you put forward a hypothesis and you test that hypothesis and you reject or you refine what you do and your treatment. The problem with a lot of alternative medicine is that nothing's thrown out. And I'd be very interested, because Dr. Hui mentioned that there was some stuff that you consider lies, and I'd love to come back to that and find out exactly what you consider lies, because very often what we find out is even the most nonsensical alternative treatments like iridology and things like that, which are just silly, aren't rejected.
Explain what that is to people who aren't initiated.
It's this sort of 18th century notion that you can look in somebody's iris and determine the disabilities of the rest of the body based on those kind of iris patterns and stuff. And there's, it's like reflexology and stuff that a small part of the body can reflect the overall health of the entire body.
Because it's 18th century doesn't automatically mean that it should be rejected.
No, I wouldn't argue that. But there's a lot of stuff that, alternatively, a lot of alternative medicine practitioners will say this is ancient wisdom, and so we can't reject ancient wisdom. Although, as you point out, just because it's 18th century, it does, female circumcision is ancient wisdom too. So simply because something's old doesn't mean it should be accepted, and simply because something's old doesn't mean it should be rejected.
Sir?
Well, I think it cuts straight to the matter. I reject the term alternative medicine because it suggests that it's an alternative. There's only one kind of medicine that's been proven safe and effective. And I agree completely with Wayne that in our travels through this area, what we came back to again and again was, if you don't have a yardstick by which you can measure something against, you're in a morass. An impossible morass. And Dr. Machino sort of put his foot into it very quickly here. He teaches at the chiropractic college, yet he rejects one of the central tenets of chiropractic. I'd like to know what the other people who teach at the college would say about that. And then when you get into that zone, not to dwell on chiropractic, but there are numerous different kinds of chiropractic, and none of the chiropractors can agree which kind is safe or efficacious. They won't discard them because they don't have a metric. against which to measure these things. And I see the same problem with Dr. Hughes saying chelation can be effective. He points to an ongoing study. Well, I'd be interested to know what happens when that study is complete, because there are several studies, and I've got them right in front of me, that have shown that chelation therapy does not work. And the major organizations in North America, including the FDA, the American Medical Association, the Cardiac Association, have all made clear statements that there is not enough scientific evidence to back up doing chelation therapy. Yet they do it and get paid for it. So I don't understand how you can function that way. If either you accept science, the scientific method, and you say studies show whether something works or not, and then you agree or disagree, or you don't. Science isn't a smorgasbord at the Holiday Inn where you get to pick things you like and leave things behind that you don't like. That's not how it works.
Well, I think I would love to write an article to my colleagues. Many people outside the world think that doctors are protecting the turf. They're not protecting the turf. They're given the notion and trained to say, believe in evidence. That sounds ideal. The problem, the public don't know, and maybe some colleagues don't know, the difficulty of finding funding for something that's non-patentable is an unsurmountable hurdle. If you find something that's, let's say, take a Chinese herbs concern, even if it's useful, nobody owns it, nobody will ever put enough money. The evidence to public means you take a whole bunch of patients and prove that it worked. That's not true. You have to do a well-designed study. If you do a little Mickey Mouse study, it will be rejected. So if you put a reasonable study, you talk about many millions. And if nobody owns that substance, it's very difficult to get funding. Government gives some basic science study, but you usually go to the high academic and the pedestal.
It puts it on an uneven playing field in terms of getting funding to actually do the research. So I know that the chiropractic profession pulls dollars together to do some studies. It's shown that for mechanical low back pain chiropractic
study in terms of funding compared with what the type of what we call serious study that we normally get used to. So I understand and respect and want to have those studies, but the thing is, where the funding come by, let's say the Chinese medicine, up to now, there's no study to show that any of the things that they're doing ever been useful. So either only logics tell you, either these old men are fooling themselves and fooling the patient, or the yardstick we use is too rigid for the situation we use. I like to have jump yardstick. My yardstick that I use is that, well, you find something useful, that's proven, that's ideal. But then when you come to conclusion, yes, you have a heart failure problem, you have shortness of breath, you're having angina. Hold off, wait till we have a study 5 years from now, if we ever get the funding, 10 years from now. I mean, human doctors are compassionate persons supposed to be, and therefore you come across that. You can stop just grabbing. If somebody falling down, you don't have the right instrument, you grab what you can help.
But how much would chelation therapy cost?
$130 per session.
Yep.
And then
how many sessions does someone usually need?
Most time, people, by the time they try 10, 15 sessions, they will see the benefit.
So we're talking about
people
maybe at least probably $3,000.
Yeah.
Substantial amount of money.
Oh, substantial.
But you can see that if it's going to save their life, I understand you. But the problem, obviously, is that if people are desperate, I fully understand this, and conventional medicine hasn't worked, and they could die, this is a hard issue, and someone says, I can cure you. $3,000, please. You can see how there will be concerns that unscrupulous people would exploit.
I think you have to judge it based on who is proposing it. Let's say speak of myself, I'm coming from a very conscientious motive. When a patient comes in front of me, I'm not thinking about money. I think what else can be done. Well, sure, when it's not covered, you think the medicine that you normally buy is not expensive, and the hospital procedure you do is not expensive, just the patient don't have to pay for it. You don't aware the cost of it.
Okay.
Few $1,000s for tackling a severe problem, life-threatening problem.
Yeah, that's not the point I'm making, though, but anyway, more on that when we come back. In a few moments on The Michael Coren Show. We'll see you very soon. Watch the commercials. Don't go away.